Hi there. Thanks for tuning in. Today I'll discuss research as it relates to the country of Belize. Belize is located in Central America. The climate is subtropical, tempered by trade winds. Temperatures in coastal areas range from 50 to 95 degrees Fahrenheit. The average rainfall varies from 50 inches in the north to 175 inches in the extreme south. The dry season usually extends from February to May, with an occasional dry spell in August. The population in Belize is estimated to be 405,623 people. Since 1950, the country's population has continued to increase. Belize has a territory of 8,880 square miles. It is bordered to the north by Mexico, to the south and west by Guatemala, and to the east by the Caribbean Sea. An estimate 31% of the population lives along the coast, with the remainder scattered widely throughout the country's interior. Some 45% of the population is urban. Belize is the only English-speaking country in Central America. While English is still the official language of Belize, Spanish is the first language of the majority. Most Spanish speakers in Belize are also fluent in English, making Belize a bilingual country. And if you count the third informal language, Belizean Creole, or Broken English, it's a trilingual country. Although Belize was first settled by the Mayas around 1500 BCE, the country was colonized by the British in the 1600s and eventually became the colony of the British Honduras, which is why English wound up as the official language. Some 14% of the population is foreign-born. 48% is Hispanic. The other major ethnic group in Belize are the original Mayans, who make up over 10% of the population. There are also the Garifunas, who account for 6% of all Belizeans. The Garifunas are descendants of shipwrecked African slave ships and native islanders from the Antilles. Over time, the shipwrecked slaves and the native cultures intermingled and became one. The British deported the Garifunas from the Antilles to Central America in the 1730s. They have lived there ever since, in Belize and on the Caribbean coast of Guatemala and Honduras. According to a 2010 census, the Roman Catholic Church is the largest religious group, accounting for 40% of the population. Protestants make up 32%, including Pentecostals, Seventh-day Adventists, Anglicans, Mennonites, Baptists, Methodists, and the Church of Nazarene. Jehovah's Witnesses made up of 2% of the population, while other religious groups, including the Church of Jesus, Buddhists, Hindus, Muslims, Rastafarians, together constitute 9%. Approximately 15% of the population does not affiliate with a listed religious organization. No religious group is the majority in any of the country's districts. Population and religion has an impact on the cultural foods that favorites to locals in Belize. Belizeans tend to eat 3 meals a day, similar fashion to North Americans. The Mestizos and the Mayas prepare their food with a Latin American influence. Corn-based fare with shredded cheese and chicken with tomatoes, peppers, and avocados. Tamales, rice and beans, stewed chicken are some of the local favorites. Creole cuisine has an Afro-Caribbean vibe to it. Lots of seafood cooked in coconut milk and rice with root vegetables like sweet potatoes, yams, and cassava. The closest thing to a national Belizean meal is called the bailap. Not as disgusting as it may appear when you account for the fact that bailap means boil up. It's a plate of boiled eggs with fish or pigtail served with root vegetables and a tomato sauce. Most local spots in Belize will serve a variation of this dish. The Garifunas also have their own cuisine. Famous Garifuna dishes include a cassava bread called the ariba and other various rice dishes. Agriculture is critical to Belize's development. It's a major source of growth, employment, foreign exchange earnings, and food and nutrition security. The agricultural sector is important both economically and socially. Agricultural production systems in Belize are quite diverse. Approximately 90,000 acres are planted to sugarcane, 50,000 acres to citrus, and another 50,000 acres to corn. Additionally, 350 acres in pastures are grazed by approximately 140,000 head of cattle. The top agricultural exports of Belize is raw sugar, bananas, orange concentrate, papayas, and animal feed. The leading agricultural imports include wheat, corn, mainly corn flour, malt, potatoes, and rice. In addition, live cattle were imported as breeding stock, and specialty cuts of meat were imported for the tourism market. Production systems of importance to food security in Belize and the land use, or the percent of total harvested area, can be seen on this chart. As sugarcane is the leader, corn, citrus, beans, rice, bananas. So how is this linked, and how do they impact the nutrition problems in Belize? Well, the economic relevance of agriculture in Belize shows that 15% of the GDP comes from agriculture. And here you can see the imports of rice, potato, malt, corn, wheat, and the exports. In labor, approximately 23,400 people, which is roughly 16% of the labor force in Belize, are employed in agriculture. Of that total, only 9% are women, working mainly in the agro-processing sector. Male labor is concentrated in the main traditional crops. So there's a big gender gap in between of the prevalence of working genders or gender inequalities in terms of people who are working in the fields for agricultural jobs. So geography and climate. Belize is vulnerable to the effects of climate change. As you can see here in this graph, this projects the change in temperature, and this projects the change in precipitation by 2050. The country's geographic location leaves it exposed to the risk of rising sea levels and frequent tropical storms, both of which lead to flooding that frequently results in human and material losses, including substantial losses within the agricultural sector. Smallholder farmers, many of whom do not have any kind of insurance to protect against weather-related risks, are most vulnerable and stand to suffer the most. Here you can just see that a negative value denotes potential decreases that can occur because of the impact of climate change on net trade. And you see rice, corn, cacao or chocolate, cattle, the banana market can all be affected. Belize has a high rate of poverty pressing nutrition problems. Rural poverty stands at 42%, with the ranks of the poor dominated by the smallholder farmers and agricultural workers. While 40% of the general population is affected, up to 50% of the Belizean children under age 15 are classified as poor. 58% of the Belizean youth under 18 are classified as multidimensionally poor. Unicef and the Economic Commission of Latin America and the Caribbean estimates that 6 out of 10 children in Belize lack one of these basic needs: adequate nutrition, clean drinking water, proper sanitation, adequate housing, and access to education and information. So despite the nation being considered self-sufficient in staples, food insecurity and malnutrition remain a present threat, as reflected by an under 5 mortality rate of 16.3 deaths per 1,000 live births. Undernourishment is present among 1 in 3 children in Belize. 6% of all children are underweight, and 3% suffer from wasting. 2% of the population is infected with HIV, and 1% of that population are women 15 years of age or older. And when it comes to education, 89% of the youth are literate, leaving 11% considered illiterate. Health problems common to Belizeans above 30 years of age include obesity and related non-communicable diseases such as diabetes, hypertension, stroke, and heart disease. This can be attributed to high food cost, inflated in some cases by border taxes and other measures imposed on imported agricultural and food products. High food prices substantially affect lower income consumers, who spend a larger portion of their income on food. Many of these problems have been exacerbated by dietary and epidemiological shifts resulting from changing food consumption patterns. So, the burden of malnutrition. According to the Global Nutrition Report, infant and young child nutrition status, this chart shows the prevalence of stunting, wasting, and overweight in children under 5 years of age. And you can see here are the trends where it's going down for stunting, but not by much, maybe 5%. Overweight has decreased, but not by much. And same thing with wasting seems to remain the same. The prevalence of coexistent stunting, wasting, and overweight in children under 5 years of age is shown on this chart with 14% stunting only, almost 7% overweight only, no numerical value for wasting. However, there's no wasting, stunting, or overweight in almost 77% as of 2015. The prevalence of infants with low birth weight has steadily decreased, however, not by much, from 9% to just about 8.6%. Child, adolescent, and nutrition status. This chart shows the prevalence of underweight, overweight, and obesity in children and adolescents age 5 to 19 years old. So here's the underweight, and we see that this trend is declining or decreasing, whereas overweight and obesity both have been increasing in the last 15 years, from 2000 to 2015. And both those numbers seem to have almost doubled. Adult nutrition status and disease. This chart shows the prevalence of underweight, overweight, and obesity in adults aged 18 years and over. So for underweight, the prevalence seems to have decreased, but for overweight and obesity, both in male and female, the numbers or the trend seems to be increasing. Prevalence of raised blood pressure and diabetes in adults aged 18 years and over show that their raised blood sugars trends are been declining since 2000. However, since 2000, diabetes, both in male and female, have been on the rise. The prevalence of anemia among women of reproductive age has decreased, but as you see here, trends seem to be on the rise again. So it's something to monitor. COVID-19, the coronavirus global pandemic. As families struggle to stay afloat, the pandemic affected essential services that secured the education and protection of the country's children. The socioeconomic impacts of COVID-19 will be felt hardest by the 40% of Belize population living in poverty. The pandemic risks plunging them further into hardship. Keeping children healthy and well-nourished is a challenge. With school closures, children who depend on school feeding programs are cut off from the food they need to learn and thrive. And according to Unicef, in Belize, about 25% of the surveyed households indicated skipping meals or reduced food intake. For some, proper hand washing is out of reach. In Belize, 1 in 3 schools have no or limited hygiene services. With schools closed to prevent the spread of COVID-19, parents, caregivers, and educators are challenged to find new ways to keep children learning. In Belize, more than 100,000 children and adolescents have been affected by school closures. This has produced a dramatic drop in the time dedicated to learning. And preliminary data show that up to half of the surveyed households have lost their job or livelihood, and 60% have suffered a reduction of income. As communities are disrupted, children are already at risk of violence. Exploitation and abuse find themselves even more vulnerable. In Belize, data shows that violence against children has increased since the beginning of the pandemic. According to the World Health Organization, in Belize from January 3rd, 2020 to July 30th, 2021, there have been 14,069 confirmed cases of COVID-19 with approximately 337 deaths. And as of July 23rd, 2021, in Belize's efforts to fight the global pandemic, 165,306 vaccine doses have been administered to their citizens. The impact on tourists and tourism. COVID-19 pandemic has had a massive impact on the economy of Belize, which relies heavily on the tourism sector. The shutdown of the tourism sector has produced significant spillover effects on other industries, as the direct, indirect, and induced contribution of the tourism sector accounts for about 40% of the country's GDP. One of the most effective sectors have been fisheries, which is second most important source of employment in Belize. Main government actions to support the fisheries sector during the pandemic include regularizing licenses of those whose license expired and arresting those who were found to be fishing illegally. The government of Belize has implemented an unemployment relief program, and this is affected for small and medium-sized enterprises. The unemployment relief program provides 150 Belize dollars every 2 weeks for 12 weeks for persons who have been laid off owing to the pandemic. So it's the Belize dollar to the US dollar is 2-to-1. So 150 Belize dollars is roughly 75 US dollars, and that is provided every 2 weeks to their citizens for 12 weeks. So not much support. The governments of the United Kingdom and Canada have collaborated with the World Health Organization, Pan American Health Organization, to provide the Ministry of Health of Belize with various items worth to help the country prepare for the resurgence of the COVID-19. The donated items consisted mainly of PPE or personal protective equipment, and that will primarily support infection prevention and control for healthcare personnel throughout the country. The European Union has also contributed and reallocated funds from the existing Belize project, and they're implementing a response in conjunction with the Pan American Health Organization and the World Health Organization also. The government of Belize has taken ownership of the Sustainable Developmental Goals. This is evidenced by the Ministry of Finance embarking on the initiative to move towards program budgeting in all line ministries to enable the monitoring of individual ministry performance in achieving the ministry objectives. So these goals have been incorporated and mainstreamed in Belize's medium and long-term development plans, in addition to the economic, social, and environmental dimensions of sustainable development. Unicef. Unicef is an absolutely amazing organization. They support nutrition programs in Belize. Under Unicef's new strategic plan, where every child survives and thrives, early childhood development and health and nutrition interventions will begin with the support for women, both before conception and during pregnancy, nutrition counseling, education for maternal energy and healthy fetal growth, weight gain monitoring, and levels of physical activity. This is something that does not exist in Belize. There's no WIC program or any source of support from the government to support new mothers or mothers with young children. UNICEF also plans to include a revision of guidelines for health facilities that offer neonatal care and for the International Code of Marketing of breast milk substitutes to be implemented in Belize. UNICEF has close linkages with social protection programs such as the Boost program, which is their unemployment, or the food pantry programs in several Belizean municipalities, which subsidize basic food supplies among vulnerable population. UNICEF is a key partner with the WASH program, And this promotes access to clean water, proper sanitation for good health in schools and homes across Belize. So the nutrition intervention I focused on related to the students that did not have access to remote learning. I selected a study by Jean Denshin Krishner, published by the International Journal of Education and Literacy Studies. This paper reports a part of the results of the Belize Education Project, co-funded by the author. As many schools across the globe swiftly pivoted to online learning during the COVID-19 school closures, the educators of Belize recognized that digital learning would leave out their marginalized students who did not have internet connectivity. Instead, the educators of Belize drew on the history of their country, using school radio to reach their youngest citizens located in remote locations without internet. This innovative solution, reaching students in villages without internet, required the collaboration of Belize's teachers and radio broadcasters. The data for this article was collected independently through a variety of methods, including interviews, focus groups, and conducted on a variety of virtual platforms, including emails and Facebook messaging conversations. Teachers, members of the Belize Ministry of Education, Belize radio executives, all families contributed to this set of data. In addition, collecting the experiences of the members who have been impacted by learning during the COVID-19 time in Belize, data collection was also included radio lessons from the Belize Ministry of Education, and that could be found on their website. Now, how effective school radio is in terms of achievement on standardized test scores in this short time is not the intent of this research. Instead, it is an examination of how teachers, administrators, radio broadcasters, and families came together across the small and resource-poor country with a common vision: to reach young learners wherever they are. Belize has nutritionists to receive formal education. The National Food and Nutrition Security Commission is a group of professionals, government and non-governmental organizations, working together to achieve the national food and nutrition security objectives. The commission was established in 2001 to serve as an advisory body to the cabinet on matters related to food and national security. Overall, the Ministry of Agriculture is responsible for chairing the commission and providing oversight powers for policy and program implementation. These are just some of the references. And thank you. That concludes the presentation.